There's been so many things that's held us down, but now it looks like things are finally coming around. I know we've got a long, long way to go, and where we'll end up, I don't know.
They haven't cut it down yet to less. So the only industry where you pay more to get less is the insurance company. And you know, how do you resolve this? It's very simple. It's a tax, like every other country in the world. But it's a 15% across the board tax. This country won't do that. Plus, the strongest industry in the world, the insurance companies. So, will they ever understand it? No. Actually, they understand it. Do they care? No. Is a different question.
So I'm Anne-Marie Campbell, and I am going to do a diagnostic tool on Miss Donna here. And so this is NASA space certified equipment that allows us to see where there's any dysfunction in the nervous system.
Okay.
That's okay, you're fine.
You know, so in this, no, I'm the.
Okay. So looking at the scan, are you okay that this is big? Okay. So green is mild, blue is moderate, and red is severe. So we do see here that there's multiple levels of nerve interference. Specifically C2 and C5 are the areas of biggest concern. So when we come over here, to our spinalator. If I click on C2, so these are the nerves that if there's interference, sometimes they can cause headaches. Sometimes we'll see different things going on in the eyes and the lacrimal glands. And then at C5,
So there are various autoimmune diseases like lupus and scleroderma, and those things all fall under autoimmune disease, which we treat. And of course, we treat fibromyalgia, which is kind of a chronic pain syndrome, which it's a very difficult thing to treat. And as you've heard today, from the different speakers, there's no one treatment that treats every single patient, and so you kind of have to tailor the therapy to each individual.
This summit has been very comforting for me because I've met with people who understand my feelings. I said to a young lady I met there that I used to have a shower and put my pajamas on wet skin, and she understood completely what I was talking about. I used to be so tired after having a shower that I wouldn't dry off. I just put on my pajamas on wet skin. So this has been a really wonderful experience, getting to meet people who are having the same concerns as I am.
Be more compassionate with your patient and trying to get an understanding. Doctors, they think sometimes they're too smart for their own good and not living in the real world. So yes, these are the signs and symptoms, and this is what you know as a physician, but as a person living with it, it may not be that point to point to point. It may not be that precise.
Okay.
So again, maybe just some understanding and compassion with your patient. It could be challenging for a caregiver, for dealing with someone who's always, depressed or in pain. But as a caregiver, you can just offer your words of encouragement and be patient with them. Don't it can be frustrating, but be patient with them and just, again, think of things that this person can enjoy. I said it earlier, it's about laugh out loud. So find some comedy, just do little things that that person likes. So, positive thoughts that you guys can talk about. Ask them, what their dreams and aspirations are, and how do you think we can do that? And watch some funny movies. Ask her who's her best friend that could cheer her up, bring them over. So it's just all about providing a positive, supportive environment for them. The summit, I'm excited. I have met some nice people. One young lady, I want to cry with her. She has cried every time she has talked to somebody. But I think it's a wonderful thing what Dr. Paris is doing. His passion for fibromyalgia and just wanting people, I share his passion and wanting people to feel good. So this summit, I think, is wonderful. I'm excited for him. I'm glad that everything has come together for him.
Okay, thank you.
I'm Pastor Randy with Renewing Your Hope Ministries. I'm here at the conference, 2015 conference, health conference for chronic illnesses. I'm excited about what God's going to do, and hopefully He does great and mighty things.
Hi, I'm Tanya, and I'm so glad to be at the 2015 health conference. I actually was a caregiver to my daughter, and the knowledge that they give in taking care of a patient, and my daughter had cancer, and so as you learn the things that help you benefit and helping your family through this, it's a great thing for more knowledge and everything. And glad to be here and glad to get more information.
I'm Lindsay Hamrick, and I live in Gray, Georgia, and I am part of the fibro group simply because I do have it, but I've combated it. And I've worked through a lot of issues, even though I continue to be a caregiver. But it does help me to utilize what is now possible. And I've even fought back from cancer last year, so we'll keep it up.
Many of the patients we treat have chronic conditions, so it's not unusual for them to see 4 and 5 doctors. So hopefully we'll talk about how we can provide them with more information that they can feel empowered to share with their other doctors, or oftentimes they come alone and have to share what their care plan is with their family members. So what can we do to make it easier for them to understand how to manage their condition and feel more empowered on how they can have a better quality of life. And I'm looking again forward to what we're going to learn today on how to improve the quality of life for patients who have chronic conditions.
So I'm Dr. Glenn Paris. I'm a rheumatologist, and I've come down to the conference here to help talk about patient-centered healthcare. This is an evolving concept in healthcare. Healthcare has been, different times in history, very, very paternalistic. This is what you need to do, trust me. Now, I think that the public is much more educated, and they're more active in participating in their own health care. So we need to move on to an arrangement where we are partners, we are consultants, where we're advising patients as opposed to dictating to patients. And part of our mandate, and this goes all the way back to the Hippocratic Oath, part of our mandate is education. Doctor means teacher, so we need to teach patients. We're looking to create a template for how patients can interact with doctors, what kinds of questions to ask, how does the doctor structure an interview so that you can have the answers ready. When you deal with an open-ended question, yes, you can bring any information into it.
My name is Virgil Roundtree. I'm here at the 2015 health conference in Macon, Georgia. This is our first health conference. We haven't gotten a big turnout right now, but I still expect people to come. And even if not, you have to start from somewhere. And I thank God that He is starting us here, because a lot of people that I talked to here in Macon, Georgia, as I was handing out the flyers and I was going back and forth to doctors' offices and I was going to businesses. And I remember this one man said, we need this here. We really need this here. But this is our first year in Macon, Georgia. We're at the Daisy Inn Hotel at the conference center, and I'm looking forward to doing more. My wife is actually the CEO of this. She's the forerunner. I'm her support and I'm her caregiver. I'm here to also learn as a caregiver how to help take care of my wife even better, how to understand her conditions, how to understand what the doctors are telling her and the decisions that she have to make, and we make the decisions together, and that two heads are better than one, and that I support her physically, mentally, and spiritually. And I thank God. We're hoping that people will come out and enjoy and look next year when we have the conference here. Last year we had it in Atlanta, Georgia, but we're looking forward to this year being even better. Like I said, a lot of people said this is well needed here, and we hope to bring it and to keep it here. Thank you very much.
And you know, a lot of times in the medical field, what we tend to do is look for symptoms, label it as a disease, and then treat that disease without, like you said, dealing with the mindset. What is really going on with the patient? Mm-hmm. And as you may have learned about me, I've been a physician for over 25 years now. And as part of my journey, I've really always wanted to emphasize prevention. And my premise is that by providing people with knowledge, we're able to empower them to make choices. So, you know, the choice that usually a lot of people face is whether they want to accept, believe, make the commitment, and then move forward. Now, those 4 steps are really very critical in any process, whether you're dealing with a chronic illness, dealing with an acute illness, or just dealing with a life situation, the ability